Hi, I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is a family-owned outpatient physical therapy clinic that has been serving Topeka and the surrounding communities since 1994. Today, we're going to continue our sports medicine series where we'll be talking about a couple of common hip ailments that we see here all the time in clinic. So the first one's kind of a two-part, and it's called snapping hip syndrome. And you can have a external or outside of the hip, or a internal or more inside of the hip. So we've got a model here, and this is showing kind of the front side. This would be the front side of the hip here, and it shows our hip flexor muscle. And so it runs from the inside of our pelvis and actually our low back as well, and comes down and attaches deep down kind of into the groin, and that's the muscle that helps us lift our leg, whether we're walking, doing stairs, or doing more sports-specific activities like running and jumping. Sometimes, if we don't have the proper balance in that hip musculature or the proper flexibility, the mobility in that hip joint, that hip muscle, that hip flexor, as it crosses the joint, can kind of bind up and catch and rub. We also have a little bursa, which is a little fluid-filled sac in that area, that if it is getting rubbed on a lot, it will swell and become irritable. So the common symptoms of that would be pain with lifting the leg, but also pain or snapping as that hip goes from a extended position into a more flexed position. That is typically an ailment that really responds well to physical therapy. A lot of times it's working to increase the overall mobility of that hip flexor muscle, but it's also a lot of times working on getting more strength and stability on those backside muscles that kind of help balance out that hip flexor. The other type of snapping hip is called an external snapping hip. We've got a small muscle on the outside of our hip called our tensor fasciae lata, or TFL for short, and then it runs a long, thick, fibrous band down the outside of our thigh called our IT band. So it kind of crosses right along the outside of that hip joint. And again, it is one particularly with endurance athletes, so more of our runners or our soccer players, where that band can become inflamed and irritated, and it will kind of snap along the outside of the hip. Very common. Fortunately, it responds extremely well to physical therapy. Again, kind of the same course of action of working to improve the mobility along that muscle, but it usually means we don't have quite as much trunk, core, and hip strength and control. We don't have that stability component in there. And so that's a big aspect of the rehab, is improving that stability. And so we don't rely on that kind of structure for support. We don't have as much irritation there. So that's internal and external snapping hip. The other ailment that we see a lot is what we call femoral acetabular impingement. Again, we put an abbreviation because it's a mouthful. So FAI would be the short version of that. And that is where the actual hip joint becomes irritated. Sometimes that can be a soft tissue issue. A lot of times that's a labral and a soft tissue. So if we can kind of imagine our hip joint and our hip bone there, what happens in the FAI is that we have a little variance in anatomy, that those two joints don't articulate or connect maybe as well as they could, and then that causes impingement, which is a fancy term for smashing or sandwiching tissue together. So if we said a normal hip alignment looks something like this, in that FAI hip, it may look something more like this or like this, which when we do more athletic pursuits can lead us to smash or impinge both those bones, but then we also have a joint capsule and muscles that surround that area, and they become irritated and inflamed. Depending on the degree of structural difference there, sometimes it is a surgical fix, but a lot of times physical therapy, particularly hands-on treatment, where we are working to improve not only just muscle flexibility, but that actual joint itself, getting it to move better, as well as maybe changing some mechanics on how that individual performs an athletic activity can make a huge difference in both performance, but also symptoms. Thank you for joining me today for our sports medicine series.